I have sent to the Congress today a series of proposals to help fight mental illness and mental retardation. These two afflictions have been long neglected. They occur more frequently, affect more people, require more prolonged treatment, cause more individual and family suffering than any other condition in American life.
Back in the 60s, it was mostly warehousing, in some sense, clients in state hospitals. And then as clients moved out of state hospitals, they moved to the local community, and Telecare was one of the first organizations to provide kind of a step-down service from the state hospitals.
Then the challenge is to develop cost-effective means, not only to treat people, but to do so in a way that there was more fluidity and movement and a better community satisfaction with the care that was provided.
Our father came home and told us there would be a ribbon-cutting ceremony at Gladman Memorial Hospital. And that here we are 50 years later, I truly believe how proud he would be of what this organization has grown to become.
We exist to do an excellent job, a superior job of delivering services for people who are most in need.
The culture of the company and the way that they treated their customers was really started by Ann's father, Mort Baker.
When I first started working for Gladman, it was sort of like a place that was for elite people who had money and could afford to be there. But as times changed, Mr. Baker had that knack in a sense of going where things were needed.
We moved from, I think in the very early days of Gladman, it was a model where it was primarily commercial pay. And then gradually over time, we also started to provide services to the public sector.
I've personally found Telecare to be very responsible. As we've developed the programs here in Orange County with Telecare, we've had to make changes, and they've always been from every level of their organization to those who sit in Alameda to those here locally are always willing to make those adjustments and problem solve with us.
First and foremost, what Telecare has brought is a collaborative competence, courage, and a willingness to serve the most difficult populations. So when others run, Telecare stands up.
As an organization, 50 years, we've evolved from being an inpatient provider to being a provider of a complete array of services to serving different customers in different populations. So that requires a kind of flexibility and adaptability and willingness to grow and change.
We feel that the most important person in our organization is the hands-on employee, the person who's dealing with the patient. These patients are difficult to take care of, and the real reward is not dollars. The real reward is some inner satisfaction, and we do render a service, and that's how we keep staff, and it shows, and we're very proud of it, by the way.
I think that I will always feel connected to Telecare because I felt that I had a part in building something, establishing something and making something big happen that so many people would benefit from.
Since the employee stock option was developed in '97, it's grown in value by 525%. So, I mean, that's a direct contribution of our employees, and we really appreciate that, and they share and we share in the benefit of that.
She has built a team that really is more like a family than it is a typical company culture.
Everyone at Telecare, this isn't just a job. This is really a place to do very meaningful and important work, and I think a characteristic Telecare employee feels darn proud about that.
Recovery-centered clinical system is a system that is meant to build the way that staff work with people from the experience of the client on up. The effectiveness when you start with the client and build services according to their needs is dramatic.
So that when we work with our clients, we're thinking of them as a whole person, and we're thinking about their physical health as well as their mental health.
We provide the support, we provide the assistance that people need to move forward in their own lives and to reach the goals that they have for themselves and their own hopes and dreams.
Going forward, I'm really optimistic that the company will be larger, that within the United States we would be a brand that people recognized as a quality standard for treating mental illness in this country.
I think because we live in such a changing environment, changing reimbursement, changing regulation, changing competition, it's been imperative that we also be flexible and adaptable and find ways to live our mission in different ways and to grow personally in the process.
And I look at those people and I think that I couldn't be prouder of them, and it's more, I'm in awe of them. It's hard to imagine a room full of people like that, excellent people, whose work of their lives is to make other lives better. And for me, I don't believe there's any other higher calling.